Anemia Diagnosis and Treatment.
Okay, so good afternoon, everybody. We are the Anemia Diagnosis and Treatment team. My name is Orla.
I'm Gujan.
My name is Miley. I'm Lillian.
I'm Jake.
My name is Rika. And I'm Fiona.
So our main focus is to educate the people most at risk for contracting the disease and educating them on the symptoms, prevention methods, and treatment plans.
Yeah, so I'll be covering diagnostic method. So there's like two main sections to my part of the slides. One is where I covered the diagnostic methods that individuals can take themselves. So these are just looking for symptoms of anemia or nutritional anemia. And then I'll be going over like lab tests that would need the patient to visit the doctor and then like accurately diagnose anemia itself. So we found like the individuals diagnosing themselves for anemia to be one of the most important things when creating the workshop, due to it empowers the individual to see the doctor, and as they are educated, they'll know that they do have anemia and they seek for treatment methods, and if they can, go to the doctor. So the specific symptoms that we wanted to cover in our workshops were general fatigue, weakness, pale or yellowish eyes and palms, and etc. So then moving on to the test side of the diagnostic methods, you have the complete blood count, or the CBC, which is just, as we all may know, taking a sample of blood from the patient, giving that to the lab where they would look under a microscope to determine the amount of red blood cells, white blood cells, or whatever's in that blood. But we're specifically looking at hemoglobin due to its interactions with iron and red blood cells. So the normal results are 14 to 11 grams per deciliter, and then we go into like anemic levels as we go down. So the other rapid diagnostic test is serum iron testing, which instead of looking at the blood in general, we're specifically looking for iron itself, or the amount of iron in the blood. And then because anemia can have many different forms, from iron, B12 to folic acid, testing for B12 or deficiency of B12 is also important in diagnosing anemia.
I'll be explaining the importance of an accurate diagnosis. Nutritional anemia can be caused by a deficiency in iron, B12, or folate. It is important to identify the exact cause in order to provide effective treatment. For example, if a patient has nutritional anemia caused by iron, they should be treated with iron supplements and iron-rich foods. It is important for the diagnosis to be provided rapidly in order to prevent the anemia from becoming severe. If the patient does have severe anemia, they might need a blood transfusion.
An accurate diagnosis is essential and should be available for each patient. Not accurately diagnosing the anemia could lead to severe symptoms like a heart failure. Being able to identify the financial needs of a patient is essential so that the patient can be provided with the affordable treatment that they need.
Seeking healthcare is so important for anemia. So if someone who has anemic symptoms feels really awful, they should seek healthcare professionals such as a doctor. And people often don't really even go to see a doctor until it starts actually interrupting their daily life, so their work, their school, etc. However, they should seek medical care before then, when it really starts to aggravate them. However, many can't really do this because of financial difficulties.
So the first part to treatments are the methods. These methods are based off the severity of the anemia with the goal of replenishing the body with nutrients, specifically iron, vitamin B12, and folic acid. For all three of these deficiencies, it's important that patients eat the right foods, take their supplements, and prepare their food well. In cases of malabsorption, where it's hard for oral treatment, patients may get injections instead with the same nutrients. And then in severe cases, you'll get blood transfusions.
And there are many limitations to be able to get these treatments, and a lot of them have to do with economics, so we can start there. So transportation, in a lot of rural areas, healthcare facilities may not be nearby, and transportation is very scarce as well. And that comes to, and there's low funding as well. So once you do get to the correct facilities, families may not be able to afford the treatment. And then there's also social beliefs. So there are many religious, tribal, and cultural beliefs in Nigeria that may clash with getting the correct treatment. And there are also many misconceptions. So because anemia is so common here, people tend to overlook it and think that you don't need to treat it. There's also a lack of education about the topic, so people don't know how to diagnose it, how to see the signs, and what to do when you get anemia.
The last part is the importance of keeping with your treatment. So patients sometimes stop taking their treatments because of side effects from the supplements, like stomach pains, constipation, and dark and fecal matter. And other times it's just hard for them to transition into a new diet. So why is this bad? It can make the disease worsen and lead to further complications, like poor mental development or poor performance in school and things like that. So what can be done? Doctor transparency, doctors providing all the information to the patients so they're aware of all the problems that could occur from this from the supplements. And then patient understanding, having patients be able to understand that these side effects are just in the short run, and in the long run they'll feel so much better.
So our workshop focuses on educating our audience, which is mothers and children, on the signs of anemia and the treatment, and most importantly, preventing it.
The first exercise of our workshop is a coloring page. We've designed a coloring page to highlight the important symptoms of anemia in a simple way so that children can understand. We've also made a diagram so that children can review and test their skills on the signs of anemia.
Each child will receive a coloring worksheet, and they will also receive colored pencils. Moderator will read the instructions out loud so that the children can follow step by step while they color. By the end of the workshop, the children will be able to take their worksheet home so that they can read it with their parents and go over the symptoms of anemia.
And while the children are coloring, the mothers will be given their own exercise. So we designed these cookbooks that are specially filled with nutritious recipes that include iron, B12, and folic acid. And in this workshop, we're going to make 2 of the recipes in the book. So the first is kumaya, which is a sweet drink that includes tiger nuts, which is a rich source of iron. The next one is miyankuka, which is a traditional savory dish that's typically made with beef, but for affordability purposes, you can replace it with tofu or beans. The mothers can take home the book and use it as a sort of meal plan if they are ever to come with anemia. And then the book includes an educational page to further educate them about the topic, and we will be learning more in the class itself.
Our last exercise we called Anemia Feud. It's meant to be for both mothers and children, so it reaches both of our target audiences. They come together to complete sort of a game show in which we have 15 questions on a 3-point scale regarding symptoms of anemia, diagnosis, signs of anemia, as well as the treatment of anemia. And whoever wins this game gets a brand new soccer ball.
So this is our itemized budget. It has everything that we need for all the workshops. So it has paper for all the cookbooks and coloring pages, all the ingredients for the cooking, and along with the 2 soccer balls that would be given to the winner. Most of these total costs are varied because of changes in prices throughout time and based off seasonal foods. So most of these will probably change higher or lower, but this is the average total cost. Thank you.
Thank you.